Today I wanted to talk about allergic reactions, what they look like, what causes them, how bad do they get, how do you know what the symptoms are, and if it's getting better or worse, how long they last, and what you can do about it if you're by yourself or you're with others and you see somebody who may be having an allergic reaction and you want to and you can help. Here's some of the things you can do and what to look for. So first of all, an allergic reaction happens when it can be absolutely anything. There's so many things these days that can cause allergic reactions. Pollen, a food allergen, medication. And most of the time, these things are really harmless molecules that would otherwise be handled by the immune system. But for whatever reason, the body reacts in a very aggressive fashion to try and mediate the perceived damage that these particles are going to have on your body. So without going into a whole bunch of examples, like I said, most things can cause an allergy. It just depends on the person and their exposure and experience in the past. But the good news is it's always going to be the same way to mitigate those problems. So you're always going to use the same kind of treatment. And it depends on if it's been happening for a long time or a short time, how well the person is going to respond to a treatment. So if you have somebody who appears to be having an allergic reaction, what does that exactly look like? Well, a lot of people will have an onset time. So it can be immediate, as soon as like a bee sting, or it can be like a food allergy where it takes a moment to happen. Peanut allergies are extremely quick acting. And then also there's things that like pollen and environmental allergens that can take up to 30 minutes to have a reaction. The difference between children and adults is mostly children will have environmental allergens or food allergies, whereas adults usually respond to allergies from medication. But like I said, the treatment is the same. When somebody has an allergic reaction, they'll immediately have that anxious feeling, concern. You'll know, if you've had it, that all of a sudden you go, oh no, I just ate that, or something I just ate had something in it that I didn't recognize, and I feel like this is coming on. And they'll get a scratchy throat, a scratchy itch in the throat. They'll start to get red in the throat or the face or the chest, arms and hands. And this could progress into a more full-blown allergic reaction depending on how sensitive they are to that antigen. So, or more to the point, how sensitive they are to the molecule. So if you notice somebody is having that reaction, stay calm, help them out. If it's you, just relax, breathe, try and understand what caused it. If you don't know, it's not a big deal. Like I said, it won't be any different in taking your medication. If you have Benadryl, and that's what you usually take. If you have an EpiPen, you might want to get that out and get it ready. We'll go over the EpiPen in a little bit. But you want to pay attention to the progression of symptoms. It'll start off as that itchiness. You'll have some redness, and a body-wide response. Maybe you feel like something is building inside of you, and that's typical. When it gets to the point where you're starting to really panic and feel like your airway is closing up, starting to breathe with a little wheezing, and you feel dizzy. Maybe your skin goes from pink and looking like inflamed to starting to get pale. You start being dizzy. We're moving into a direction of anaphylaxis. Anaphylaxis is a full body response. So how can you tell if it's a mild allergic reaction or something serious, and when should you use an EpiPen auto-injector? Simply put, a mild reaction is itchy skin, hives, watery eyes, mild swelling, stuffy nose, redness on the skin. And something serious, which is anaphylaxis, is noted by trouble breathing and swelling of the lips, tongue, throat, dizziness, blood pressure starts to drop, some vomiting, maybe confusion, and ultimately a loss of consciousness. And those folks need the EpiPen. If you're not sure whether to use an EpiPen, use it. That's the bottom line. And it's very safe, and it will quickly offer some relief, give everybody a moment to regroup and make the next plan to get them to definitive medical care. So here's how you use an EpiPen. If you haven't used one before, you simply grab the EpiPen with your dominant hand, take off the blue protective cover on one side. The bottom side will have an orange covering over the needle. That's all you have to do to prepare. Then you look for a bulky muscle. You can use preferably a thigh muscle, but you can use a shoulder or an arm, whatever you can get to. Clothes don't matter, you can go through clothes with it. And you're just gonna put a significant pressure onto that muscle with the EpiPen. That will depress the covering, the orange covering over the needle. The needle will inject the epinephrine into the muscle. It will get absorbed very quickly. Hold it for 3 seconds, make sure it all gets absorbed, take it out, set it aside, it's done. Watch for a response from yourself or the patient. Feel like they're getting some relief, symptoms start to resolve, and particularly breathing gets better, consciousness starts to increase, and they begin to respond to you. You can use a second EpiPen if you have another one after 10 minutes. If you have allergic reaction or come across somebody who's having an allergic reaction and you don't have an EpiPen or Benadryl, then you can just stay calm, stay with them, lay them flat, elevate their head if they're having trouble breathing, and elevate their legs if it seems like their blood pressure is getting low and their skin's getting clammy, and just stay with them. If it progresses to the point where they're unconscious and their heart stops, this is a possibility with somebody with anaphylaxis. You can consider doing CPR, and I'd recommend it. Make sure that you have contacted 911 and help is on the way, and just continue until help arrives. And you'll have done your part to make this outcome way better than if you weren't there at all. If you have Benadryl, or the person has Benadryl that's having an allergic reaction, and you know they're not allergic to the Benadryl itself. Some people are to the preservative that's in, or the food coloring that's in Benadryl, but most people are fine with it. You can give 25 to 50 milligrams by mouth if they're conscious and able to swallow a Benadryl or two, and that's an excellent opportunity that you have if you have that medication with you. All right, so I hope this helps, and let me know if there's any questions I can answer. Take care.